Hi, my name is Karen and I'm here at the Kentucky Equine Adoption Center, and today we are going to talk about horses' teeth. It's really important to take proper care of them, just like it's important for you to go to the dentist on a regular basis to make sure your teeth are healthy. It's really important for horses. The first thing we're going to talk about are the individual teeth, but does anybody have any idea how many teeth a horse has? So think about that for a minute. There are actually between 40 and 44 teeth in a horse's mouth. Now that's compared with your mouth, which has about 32 teeth. So horses have several more teeth than we as humans do. And basically the teeth are very similar to our teeth as far as what they're called. Does anybody know what these front teeth are called? I've only had one person in all the years we've been doing Take the Reins get this answer right. So think about it for a minute. Same as your front teeth here. These are called the incisors. And the incisors, there are 6 on the top and 6 on the bottom, and they are responsible for grabbing and ripping grass off the ground. When the horse does that, they move the grass back to the back part of their mouth where these teeth are, and everybody probably knows what these are because we have the same teeth in our mouth. They're called the molars. And the molars are responsible for grinding and masticating the food before they swallow it. So mastication is the process of chewing food. It's kind of a cool word, mastication. We masticate when we eat food as well. And you'll also notice that there's this big space between the incisors and the molars, and that is called the interstitial space. And that is the space where if you see a horse being ridden and has a bridle on, where the bit goes. So it's very open, and it's basically just feels like a bunch of gums. The other teeth, and you don't see them in this horse because they've been removed, or in the skull, are the wolf teeth. And the wolf teeth are tiny little teeth that show up right before the molars start. They're actually premolars, and they're actually vestiges of teeth and what teeth were like, you know, hundreds of thousands of years ago. Those wolf teeth are usually removed from a horse because they don't really serve a purpose anymore, and sometimes they can get infected and painful, and there's just really no reason for a horse to keep its wolf teeth. So they're very little. They almost look like stunted baby teeth that you sometimes see in front of where the molars start. So why do you think it's important to take care of your teeth? Why is it important for you to take care of your teeth? Well, first of all, you don't want to walk around with a bunch of yellow teeth, right? For horses, it's really important that we take care of their teeth because if we don't, they can't chew their food properly. And here at the Kentucky Equine Adoption Center, we get a lot of horses in that are very, very skinny. And the first thing we do when they look like that is we look at their teeth. And a lot of times, those teeth have not been taken care of. And what happens is, on the molars, there are little sharp areas along the edges of the molars that will continue to grow. And those areas are called points, and those points can get really, really sharp if a horse's mouth is not taken care of. And when that happens, those points dig into the side of the horse's cheek, and it can bleed and be very painful. So how many of you guys have eaten a French fry and stabbed the roof of your mouth with a French fry when it was really sharp? Or a potato chip, or a tortilla chip? It really hurts, right? Well, that's kind of the same thing a horse feels when their teeth have these really sharp points, but it doesn't get any better because these teeth have to be what's called floated. And you're going to get to see that in another part of the video. You'll actually get to see one of our veterinarians float a horse's teeth. And floating is what we call it when we take care of horses' teeth. And we're actually filing the sharp points of these teeth down so that they don't cut into the side of a horse's mouth, and it's smooth. When a horse is born, it's born only with a certain amount of tooth, and that is about 4 inches. So when a horse is born, there's about this much tooth available to it during its whole life. So as a horse ages, those teeth constantly erupt from the gum area at the rate of about 1/8 of an inch a year. So that's like about this much. So every year the tooth grows about this much. And when they run out of tooth, obviously, there's none left. And so when horses get really, really old, sometimes their teeth are so ground down, or they're just like little stubs, that they can't eat or chew very well anymore, and their food has to be adjusted because of that. So horses are born with about 4 inches of tooth, and that tooth constantly grows as the horse ages, and at some point they get to the end. They don't really totally run out, but there just isn't any more tooth to come out of the gum, and so that area gets really, really worn down. So just to go over a little bit of what I just explained, because I gave your teacher a vocabulary list, and she might use that in a little quiz later, or use it for part of her discussion. Front teeth are called incisors, 6 on the front, 6 on the bottom. Back teeth are called molars, 6 on the top, 6 on the bottom. The wolf teeth are those tiny little teeth that are right in front of the molars. It's actually a premolar. Those are usually taken out. Floating is what the dentist does when they take care of the horse's teeth. They file it down so things are smooth. And that is also to get rid of these sharp points that will form on the edges of the teeth if the horse's teeth have not been taken care of. I don't have all the tools here, but you'll see them in the video. So what do you think is used to float horses' teeth? It's actually a big thing called a rasp. It's about this long, and it has a metal surface at the end of it that vibrates, and it's kind of like a rasp or a file, kind of like a nail file, and that rasp will grind down parts of the teeth that need attention. Usually that rasp is motorized, but we've seen dentists do it without motors. It just takes a little bit longer. And the other thing a dentist will do when they look at a horse's mouth, they're going to look at the overall condition of the teeth, if they're any worn down. As they poke around in the horse's mouth, they will notice if there's some redness or swelling in the gums, which could indicate some kind of infection. They're also going to just look at how close the teeth are to each other. Horses' teeth should not be far apart, kind of like us. And when they are far apart or too far apart, this little area in between the two teeth that aren't close enough is called a diastema. And that diastema is a really good place for food and hay and grain to pack and never get out. And when that happens, the gum can get really infected and cause a lot of irritation. So another reason why we have vets come out to check horses' teeth is if they see that forming, they can flush it out of the horse's mouth and keep that area pretty clean. So diastemas, which is another cool word, are the spaces that sometimes form between teeth. When a horse chews, it's really different from the way we chew. So think of how you eat a hamburger or a sandwich. Your mouth pretty much goes up and down all the time. A horse doesn't go up and down like we do. They grind their food, and they do it in what we say an elliptical fashion. So an elliptical is an oval, and when they grind their food, they're moving their jaw in kind of an oval shape and kind of side to side so they can grind everything down. So you can imagine if some of these teeth are really sore, or they have sharp points on them, or they don't meet the way they should, they can't grind the food the way they ought to. And so when that happens, they're chewing undigested food, or they're just not getting all the nutrients out of the food that they should, or they drop it out of their mouth. Another reason why horses get really, really skinny. So when the dentist is done floating the teeth, and you'll see this in the video, they will take the horse's head, they'll gently hold the horse near its nose, and they'll hold the jaw, and they'll move the horse's mouth back and forth. And what they're looking for is that all of these teeth on the top are meeting all of the teeth on the bottom, which makes sense because that means the grinding is going to be a lot more effective. And when they do that, they're looking what's called for good occlusion, which is another really cool word. Occlusion basically means contact, that the upper teeth and the bottom teeth have appropriate contact, and they're meeting all together, and their horse is able to chew and grind the food up properly. So how often do you go to the dentist? I'm guessing you probably go maybe twice a year, every 6 months or so, depending on what's going on. With a horse, the average horse that's been taken care of and that's healthy usually only has to get their teeth floated about once a year. Now, if they're really old, sometimes you can stretch it out to 1.5 years, 2 years, because just like people, horses slow down when they get old. but the average horse only has to get its teeth floated about once a year. We've had some horses come in, their teeth are really long, and sometimes the dentist will have to come back every few months to check on the teeth, file them down a little bit more, and get them to the proper shape and size. And sometimes people do have people come out and look at their horse's teeth about every 6 months, but the general average is about once a year. So it's really important to take care of your horse's teeth so they can chew their food basically and maintain a really healthy weight. You don't want infections to get in there, and just recently we had a horse go to the clinic here. He's older, he's 21, and we didn't know anything about this until the vet came out, but turned out because his teeth had not been taken care of properly, he had a lot of infection in his incisors. And it was so bad, and all of the teeth were affected, that they had to remove all of these teeth. So one might think, how does a horse eat if they have no teeth in the front? Well, first of all, the condition was probably pretty painful, and now that his teeth are gone, he's not in pain anymore. And interestingly, horses can adapt. The vet told us that when horses don't have any of their incisors in front, it's best to put them out in a pasture where the grass is a little longer than you normally would keep the grass, so that their lips basically and their gums can grab onto grass that's a little higher than it needs to be if they have their teeth. And he is actually doing fine. He also eats grain every day, and that grain has to be wetted so that it's just kind of like oatmeal, that kind of consistency, because he can't obviously chew it very well. So those are the only adjustments we've had to make, and I've never seen a horse without any teeth, but this horse has no teeth in the front, and he seems to be doing very well. Obviously, we don't want any horse's teeth to get to that condition. For one thing, the surgery is very expensive. And for another thing, you know, horses aren't meant to go through life without their teeth. So, but the good news is that there are veterinarians who know what to do, and it is a treatable condition, and horses can, you know, live out the rest of their life fairly comfortably. So that's what I know about teeth right now. Enjoy the rest of the presentation. Enjoy watching a horse's mouth teeth get floated. She will sedate the horse, which means the horse will not feel any pain, and it will be able to keep its mouth open, but it's a really interesting procedure, and you'll get to see inside the horse's mouth. So thanks for joining us today, and we will see you next time.
So what I have to do is I have to give him some sedation or tranquilizer, get him really sleepy so he's relaxed enough that I can open his mouth, and then I can put my arm in there. You guys need to put your hands in there, and it prevents him from biting you. And you can also look and see if there's any broken teeth, any infection in there. So what I'm going to do is I'm going to sedate him really quick, and then I'm going to go over the skull with you guys so you know what you're feeling for.
Whenever you sedate him, does it hurt him or no?
No, some horses don't like, just like us. Some people don't mind getting a shot, some people do. So it just depends. They're just like us. Some don't like it, some are okay with it. So I don't know him, so we'll see how he goes. So, did he move at all? No. No, so he's good with it, which is nice for me. All right, guys. So he's gonna fall asleep, and what we're gonna do, we're gonna try and stay pretty quiet, okay? Because if we're loud, make loud noises, it's gonna make him wake up, okay? So we wanna try and be as nice and calm as we can. So this is actually a real horse skull, okay? So horses' teeth, they actually erupt their whole lives. So for us, what happens? You have your baby teeth, right? They fall out, and then your adult teeth grow in. That's all you have for life, right? Horses, they are somewhat the same way. So they have some baby teeth that'll fall out, but all their adult teeth can start out really, really long. So they'll go all the way up here into their sinuses, okay? And as they get older and they start chewing all that hay, their teeth keep growing down farther and farther and farther. And so a young horse, they'll have teeth really, really long. An old horse, like him, they have really, really short teeth because they're almost all worn away, okay? But what happens is, I'll show you this. So horses have two different structures to their teeth, and I'll go down the line. So they have, around the outside, and I'll show you, they have little tan pockets. Those are your pulp horns. That's what has your blood vessels and your nerves. And then in the middle, which is the nice kind of white part, is called infundibulum, okay? We can't ask the horse to open its mouth, right? So what I do is I have this, what we call mouth speculum. So his teeth are gonna fit right on here, and that'll let me open his mouth so we can all take a feel and a look in there, okay?
You can't close it.
So yeah, he can't close it. Once it's open, he can't close his mouth at all. We have to, we might need to jam up against the wall.
Did you see the horse just move himself down?
As long as he's a square, that'll be your job, just to
I had him square a minute ago, and then he started really leaning.
So guys, I'm just rinsing on his mouth.
Yeah, I know.
Wow.
Whoa.
All right, guys.
Can't do it.
Oh, so, so I'm gonna clean. He has some tartar on his teeth. So that's actually all tartar that I was just able to chip off his teeth. I know, it's a lot, right? This is why you guys go to the dentist every year, right? So,
Twice a year.
Twice a year, there you go.
3 times a year.
3 times! Oh my goodness, I don't think I've ever been to the dentist
Every day?
that long.
It's just like every hour. Okay. He needs a lot of something.
He does need a lot of help.
My teeth are one thickness. Mark, take one step. There's yellow as gold.
The one that Jordan did when she tried to get it, she accidentally took the whole thing off. It was like a whole crown piece. Like, the whole big thing. Yeah.
I'm just worried I'm gonna break my tool.
Oh yeah, for sure.
And this one's a lot sharper than Jordan's. Here's a, so guys, here's a really nice big piece. Wow. That's popped off. So he has a lot of tartar on his teeth.
If we're being honest, Jordan didn't even actually use a, she used a screwdriver.
I would say, yeah, not many people have the tools that I do just because since I specialize in dentistry. I don't think they even have a mirror, to be honest. So I wouldn't be surprised if he has a bad canine, to be honest.
So how do horses get tartar? I mean, all they eat is grass.
So, yep, so, oh, jeez. So all their hay has so much mineral in it. What I'm thinking is I think he has a diseased canine, to be honest, like the eoteric type canine. And it's painful for him to move his tongue over and clean off his teeth.
I'm called.
Oh yeah, he's got an abscess here. Yeah, see? Yeah. So I think he does have eoteric, like Wendell. See that right there? It's all feed packed in there and an abscess. So I think he has the same problem that
So he's gonna
Wendell
have to do
did.
the same thing as Wendell.
In theory, I would have to take
Look at his
radiographs.
incisors because they look like
They do.
Wendell said.
They do. Yeah, that's pus right there. Let's pull that out from down in the gum.
Oh, here.
Oh, poor
Yeah.
guy.
It's really nasty.
It's like a piece of wood.
Yeah, so he's definitely, and see how it's all that petechia around right there?
Yeah.
Those are all pustules. So yeah, he has a diseased canine. I'd be 99% positive. But not many people would know that if you're not a dentist or do dentistry as a specialty. So, I'd probably recommend doing radiographs.
That's just his canines thing.
No, I do all of them because his incisor show changes. Sorry, this is a very exciting part for the kids.
Oh, that's how it makes me.
I know, right?
So what she's doing is she's picking all the tartar off around, and come to find out he has an abscess on his tooth. So she just pulled a piece of wood out of his
I'm
gums.
not going to take the rest of this off because if we need to take it out, there's no
So she's gonna stop, and he'll eventually go into the clinic to have his teeth removed.
Yeah, we'll take some radiographs of his teeth and take a look. Do you guys have any questions about this before we finish up with the dental part? No? Okay. Yeah. Doing the dental, so nothing really hurts. So his teeth are really short, like we were talking about. I have a feeling this tooth that I just took all this tartar off of, I think that tooth is hurt, but he didn't show me anything. So horses are prey animals, which means if there's a lion or a tiger coming after you, do you want to show that you have a weakness? No, right? You don't want them to know. So horses can be really stoic, so they just don't, sometimes they don't show their pain. But just from me looking at that and seeing that he has some infection there, I'm pretty sure he hurts. Yeah, so that's why we're gonna take some radiographs and we'll help take that tooth out so it doesn't hurt him anymore. Yeah. No, so we don't brush our teeth. And I'm just gonna take this off and let him balance himself. So we don't brush horses' teeth. When they're eating the grass and their hay, it's really rough, and so it kind of helps with their teeth. You should, he's being really goofy. You should never be able to floss between horses' teeth. You know how for us, we like to floss between our teeth. Horses, you should never be able to do that because then feed can get trapped in between and they don't have us to floss out their teeth, right? So for horses, they're specifically meant to have teeth that kind of interdigitate so that way you can't fit any feed between and potentially get infection there.
Hold on.
Yeah, I don't know if you want to show a picture of his incisors. So see how bulbous that is? So I have a feeling. Yeah.
How long does the stuff last?
The sedation, he'll be asleep for about 30 minutes.
Wow.
Yeah, yeah. Be careful back there. He's asleep, but he can still go backwards. You see it? There's like a huge pocket. Yeah. So, all right, do you guys have any other questions? No? Well, thank you guys. I hope you had fun.